And welcome into this edition of ACAP Today for the week of October 10, 2022. I'm Jason Parent with Aroostook County Action Program. On this week's edition of ACAP Today, we're going to talk with three oral health professionals, one from the West Coast and two from right here in Aroostook County, about the concept of the virtual dental home. It's here in Maine and it's here in the county now, and we're going to learn a little bit more about this new program getting off the ground and why it might be beneficial to you and your family. We're going to do that in just a little bit, but before we get to that, we're first going to turn to this week's news and information that you can use. Again, for this, the week of October 10th, 2022. We begin with the news and information that you can use with this. We are inviting new and expecting parents to join us for our community baby shower. There will be two sessions of this baby shower. Both will be held on Friday, October 28th. At our 771 Main Street Presque Isle Customer Service Center. The first session will be held at 10 a.m. that day, and then the second session will follow at 12:30 p.m. There'll be repeat sessions, so you just have to attend one of the sessions, not both. At each of those sessions, they will begin with a short informational talk on safe sleep and how to best help ensure your babies are sleeping safely. And then there will be vendor tables available. There will be opportunities to connect with local agencies who provide resources and services to new and expectant parents, as well as some great door prizes that will be available for the winning. And I've seen some of them, and trust me, parents, it is worth your attending for a chance to win some of those wonderful door prizes and to walk away with a lot of really valuable information and resources for new and expectant parents. Space is limited. You can go to ACAP's Facebook page, Facebook presence, or website to register for this event for either of the two sessions. It'll let you know how enrollment is going there, so you are not enrolling for a session that's already filled. Registered attendees will receive, everyone will receive a free welcome baby bag full of useful items and information to support them and their new baby. So even if you don't win one of the lovely door prizes, you will all walk away with a free welcome baby bag full of useful items. This is Sober October. We're into the second week of Sober October, but it's not too late for you to take a pledge to be sober through the rest of the month of October and to refrain from using alcoholic beverages throughout this period. We are inviting the community and community members to make a commitment to increase the chances you'll stick with it. You can join the community of support through ACAP's Facebook presence or website, and you'll be provided with access to weekly emails. You'll join a private Facebook group. You'll have invitations to gatherings and events held later this month, and prize drawings that will be held at the end of the month. You'll be eligible for those as well. So consider taking the Sober October pledge. Go to acap-me.org. Maine's water assistance program launched last month, and it is still taking one limited time program. It's a limited time program and still taking applications to assist Maine residents who may have fallen behind or had difficulty paying their drinking water and wastewater bills. The program itself provides direct payments to water and sewer utilities on behalf of the customer. So if you apply, your bill will be paid for directly to, or a credit will go on to your direct program service provider, as opposed to coming to you. It's the program that is available to Mainers who qualify income or who are eligible. You can go to the Maine Housing website at mainhousing.org to find out more, including details of what the Maine Water Assistance Program covers, which is listed there on your screen, but more details are available at mainhousing.org. We are also welcoming in to our preschool partnerships 4 area schools: Fort Kent, Limestone, Caribou, and Van Buren. We will be celebrating beginning next week. We already celebrated in Fort Kent last month, but beginning next week on the 18th of October, on Tuesday the 18th, we will be at Caribou's ACAP Early Care and Education Center, along with our friends from RSU 39 to celebrate that new pre-K Head Start partnership between ACAP and RSU 39. 2 days later, on the 20th, on Thursday the 20th, we'll be at the Limestone Community School, where we have embedded a classroom there in partnership with the community school, and we'd love to have folks join us from the Limestone community at that event at 93 High School, or the site of Limestone Community School. And then lastly, on the 25th, on Tuesday the 25th, we'll be up in Van Buren at the Van Buren District School, where we will be celebrating our new Head Start preschool partnership up there in Van Buren with the folks in that community. Please, if you are in one of these communities or are connected to these programs or would like to learn more about these programs, including if you could see your young children in these programs at one point, we invite you to join us for these preschool partnership celebrations and opportunities to connect and link with us. And we are nearing just a few weeks left for the Gons Berry Farm Corn Maze for 2022 in honor of ACAP's 50th anniversary. We encourage one and all to go take your luck and have a good time in the corn maze. There's some wonderful games. There's about 6 games to play there, and there's some delicious ice cream to be had at the corn maze. And you can also play 9 or 18 holes of golf and just have a great family day out there. And we encourage one and all to go and to join in the corn maze activity out there at Gons Berry Farms, and our hats off to them. And again, a deep appreciation for their dedicating the corn maze in honor of our agency's 50th anniversary and 50 years of service to Aroostook County. Thank you to Gons. Community Closet is available 24/7 to anyone in need at ACAP 771 at Main Street, Presque location. If you are looking for volunteer hours, whether you're a youth or whether you're an older member of our community, we would certainly welcome your assistance. It takes a lot to keep the clothes organized in the closet, get it hung, and get it there so that it's available to community members and to sort through donations of clothing that we receive. If you would like to donate to do that, you can call Kim Garrett-Michaud at ACAP at 764-3721, extension 246. Her email address is there on your screen as well. If you prefer to contact her that way, please contact Kim Garrett-Michaud. The Home Energy Assistance Program is doing well in this season, and we are encouraging folks with the higher cost of fuel oil and some news of late that makes it seem like the cost may go up even more than this high cost it has right now. We are encouraging you to apply for the Home Energy Assistance Program. If you think that your income levels come close to meeting these income qualification guidelines, if you have out-of-pocket expenses like medical expenses, we can work with you to see how we might deduct those from your overall income to see if you meet these income eligibility guidelines. We encourage you to please give us a call. We are currently scheduling appointments in November and would welcome the opportunity to serve you and your family this way. We're also getting ready to gear up in November for our Helping Hands Telethon, which will be held on the 17th of November. And we look forward to our partnership with WAGM and the United Way of Aroostook for that. In the meantime, if you're in need of or considering applying for the Home Energy Assistance Program this year, please do contact us. Information is there on your screen. Our direct hotline for home energy assistance is 768-3053. And we are inviting you to connect with a new resource or an old resource that we want to remind you of about being healthy on a budget. Many folks are concerned about the cost, the increased cost and inflation on everything, including on groceries. So how do you stay healthy on a budget when some of the healthiest foods are some of the more expensive foods as well? That's traditionally the case. And we certainly are encouraging you to use Main Snap Ed, which is a partner of ACAP. MainSnapEd.org is the website. You can go to MainSnapEd.org and figure out how you can help stay healthy, eating on a healthy budget through this website. So we encourage you all to look into that opportunity. Again, MainSnapEd.org. And we also, in context of our COVID-19 corner and information, news and information you can use as it relates to the COVID-19 pandemic and the continued impact of that, we are certainly encouraging folks to get that booster. You are eligible for another booster. Everyone 12 years and older, if it's been 2 months since your last dose. This latest variation of boosters are more effective on some of the variations of COVID-19, including Omicron, as it has transformed over the period of time. Anyone aged 6 months or older are eligible to receive an initial COVID-19 vaccine as well. For more information, including a list of vaccination sites, you can go to the maine.gov COVID-19/vaccines site. You can also, if you need help registering for a vaccine appointment and aren't quite sure where to go or how to connect, you can give us a call here at ACAP at 764-3721. And we're also reminding folks that free at-home COVID-19 tests are still available. There's a couple of websites we want to point you to. One is covidtest.gov. The other is accesscovidtest.gov. and there have been new infiltrations or new allotments, I should say, of these tests that are now available for households. So if you ordered before, you may want to go back and visit these websites. Your household may have been recycled, and you are now again able to order those for delivery to your home. And also, speaking of COVID-19, if you are diagnosed with COVID-19 and you are asked to isolate or quarantine and you are in need of groceries or other services, that's where ACAP's COVID-19 Community Supports in partnership with the Department of Health and Human Services do step in. The community care for social supports are available through referral form that you can get on the maine.gov DHHS website, or by calling us here at ACAP at 764-3721. And at this point in the broadcast, if you haven't heard of a program or service that we offer, but you find yourself in need of assistance that doesn't appear to be readily available through those programs and services we talked about, please do give us a call at 764-3721. We have navigators who are available to connect with you, and they can go over a full list of programs, listen to what your needs are, and either help you connect with those programs here at ACAP or help you connect with those programs at another agency. So that's this week's news and information you can use for this week's edition of ACAP Today. And as I mentioned at the top of the broadcast, we are talking this week on ACAP Today about the concept of the virtual dental home. And we're joined by three guests, two of whom are familiar to our Aroostook County audiences here on ACAP Today. First, Lucy Morin, who's ACAP's dental hygienist and also our resident potato picker. We've had her on recently talking more about picking potatoes than we have about her daytime job, but we're happy to have you back on topic with your daytime job, Lucy, with that. And speaking of picking potatoes in this Aroostook County harvest season, a farmer's daughter herself, Dr. Norma Desjardins, who's been on ACAP Today. It's been a little bit since we've had her on ACAP Today, but so proud and pleased to have you back, Norma.
Thank you.
And our next guest, who I'm going to have do a little bit of a further introduction of himself, is coming to us all the way from the West Coast, the wonders of Zoom. We're able to have him join us today. And that's Dr. Paul Glassman. And Dr. Glassman, before we get into the concept of what a virtual dental home is, which I'm going to have you cover, sort of tell us about your background and how you came into this and how you fit into the equation of this conversation that we're having today.
Sure. Thank you again for the invitation and happy to be here. So my current job is I'm working as the Associate Dean for Research and Community Engagement at a dental school in California, actually a newly forming dental school at California North State University. But I've been working with dental care, particularly my career has been very focused on getting dental care and dental health to people who have trouble getting care in the normal dental care system, someone who just can't easily come into a dental office and make regular appointments. And so that's been something I've been concerned about for really decades now. And about 2 decades ago, I had been working on several kinds of systems that had dental hygienists in particular going to places where people are that have trouble getting care. And so we were finding that there was a lot of things that dental hygienists could do with outside of a dental office in terms of preventive procedures and identifying what kind of needs people had, but they were still disconnected from the dental office. And then about maybe 15, 18 years ago, 20 years ago, the technology began to get good enough, and we started to see the advent of telehealth, much more widespread in medicine then and now, but where we found we could actually begin to connect people who were in a community with a dentist who was in a dental office. And so adding that to the idea, we knew we could reach people better if we were bringing care to where they were than we could requiring everyone to come to dental office. The advent of the technology, we began to put all that together. And so for the last almost 20 years now, I've been working on this idea of using what I sometimes call telehealth connected teams, and using those teams to be able to work together, different people in different places, but forming a full dental home for people where different people are in different places. So we came up with the idea of the virtual dental home as a term to describe that kind of system of care.
Now, Dr. Norma Desjardins, in your passion-driven work with St. Apollonia Dental Clinic and really throughout your professional career as a dentist, this sounds very much aligned in terms of serving an underserved population with what has really been the purpose of your lifelong work. So talk about your engagement with this and your thoughts about the concept of the virtual dental home.
Well, it definitely does or has become evident that in today's world, we we still are not reaching everybody we'd like to reach to have them have optimal oral health. And sometimes we need to reach them where they are and not just where we are. And so this is a way that we can have that outreach and have a dentist overseeing charts, so that the child, for example, can still have a dental home with a dental chart, and have the experience of having all of the preventive services done in their location or where they are, for example, at school or in a Head Start site, and then have a dentist who can virtually log into their chart, can see their x-rays, can communicate with the hygienist, and can see them for their operative work if they need operative work at the dentist location.
And Lucy, in terms of the work that you do for us here at ACAP and your work as a dental hygienist, how does the work of the virtual dental home sort of connect with and weave within the work that you're doing? Because you're getting out there across Aroostook County in public schools mostly, and in our early care and education programs here at ACAP. But how is this beneficial to the work you're doing and the work that the oral health community across the county is doing?
Well, it's absolutely amazing to be having a dentist overlook the charts that will be in the system. And I'm sorry, I'm nervous, Jason.
That's okay.
Oh boy. I'm sorry.
That's okay. We'll come back to you and
Okay.
sort of find out how it's going, Dr. Glassman, for the work that you've been doing, not only here in Aroostook County, but elsewhere. Are you seeing some early results, some early wins as a result of virtual dental home activity, not only here in the county, but elsewhere?
Yeah, so let me interpret the elsewhere in two different ways. So one would be elsewhere in Maine, but also elsewhere across the country. So, as you indicated earlier, I started this work in California. We've had now almost 20 years of experience doing this in California, but also in a number of other states. So this idea of using telehealth connected teams and creating these virtual dental homes is now being recognized really across the country. There are many states that have changed their policy environment, expanded new laws to allow, for example, dental hygienists to do certain things, expanded the laws to allow payment for that. We've got some implementations going in California that have been going for really almost 18 years. There's one in particular, a couple in particular, both a similar story, that started out with a dental provider working with one Head Start center, and one that's in a county just south of San Francisco, near where I am, is they're working in 27 different sites across their county now. So the idea, clearly, once people get it and figure out how to do it, can expand dramatically and allow someone to have a really big sort of practice without walls, where they're reaching a lot of people. I'm now working and consulting with people in a whole bunch of other states around the country. And one very exciting implementation has been the one that's going on in Maine, because of the the desire now to create a statewide project where people in various counties can be working together and learning from each other as this all progresses. And that I really haven't had that opportunity so much outside of California before. So I think the statewide approach that's in Maine is really pretty exciting. And I think it's going to allow some benefits that are beyond what each individual provider can do, because the ability to learn from each other and the ability to work together cooperatively and share tips and tricks on what's make this work is really very helpful.
Given your experience and the 20-year experience that you talked about in California, if you were to sort of follow that trajectory, this is in its infancy here in Maine. Where does it go from here? What should people start to expect? Because I think one of the things we're doing here is trying to get the word out that this is in existence, this is starting, this is getting off the ground. From your experience, how does it evolve next?
Well, when I talk about what are the things that allow this kind of idea to actually take place and really be happening in the real world, I talk about three issues. So one of them is awareness. There's a lot of people that don't even think about this as a way of doing dental care. I say most people probably in our society ask about dental care. What's that? That means you pick up the phone and you call a dental office, you make an appointment and go there. That's what dental care is. So even having people begin to think about this different way of having dental health is a challenge. So I think there's good progress across the country, and in Maine now more and more awareness. I'm sure this interview and your publication of it's going to help with that awareness. So awareness continues to be a challenge, but we're making good progress with that. The second major thing that's going to allow this to move forward is policy. So with this project going on now in Maine, there has been a lot of policy work, a lot of people discussing these issues with around payment and scope of practice, and some things that were not so clear before are getting clarified. So the clearer the policy is, the clearer people understand what they're allowed to do and how they get paid for it, the more likely it is for people to do this. And the third thing is implementation challenges. So this is not easy work, particularly for dentists who may be interested. There's, I sometimes joke with, I'm giving an audience of dentists, and I said, how many of you remember the class you took in school about how to make an MOU with a Head Start center that's in your community? Of course, everybody laughs because there's no classes like that. That's just not something dentists are trained to do. So all of those things about connecting with the community and making arrangements and figuring out operational protocols across different kinds of systems are all relatively new to the dental care delivery systems. And so, again, those things are starting to get worked out through this project, through various people in the various counties are starting to figure that stuff out with help. And I think that it's the kind of thing that builds on itself. So the more one person does it and figures out something about it, the more comfortable the next person is coming in, and maybe they add something that the first person learns from. So I see this, it's been happening now over the last decade across the country. People are learning from each other's progress, and I see it happening in Maine, where the various counties that are doing this are beginning to try some things, learn from each other, give each other some feedback. And so the trajectory is clearly up. I don't want to leave the impression that this is all going to get figured out, by next Tuesday, because it's not, because this is complicated stuff and it takes a while to put all these things into place. But I think the momentum and the direction is good, and I'm very optimistic this is going to become more and more a part of the way dental care is delivered in Maine, but across the country. And I just would add one thing to that. If you put on the really long vision, I typically say when people talk about dental care 20 years from now, if you could, get in a time machine and go forward 20 years from now, and you ask somebody, whether it's in the general population or a dentist or anyone else, is telehealth something that's used as a part of the way dental care is done, this kind of telehealth and virtual dental homes? The answer will be, well, of course it is. Why would we not do that? It's the same way as if you ask someone today, do you think it's a good thing for people to have smartphones? Well, everyone's got a smartphone, right? But 10 years ago, you ask someone that question, they wouldn't even know what you were talking about. So I think this is going to become more and more a part of our world, and the way we think about it, and the whole mindset of it being something new and weird and different is going to start to dissipate, and it'll be just the way we do things as we figured out how to do it.
So Dr. Norma Desjardins, as I transition to you on this question, as Dr. Glassman was talking about, a dentist, practicing dentists that are not necessarily as adept to doing things like MOUs with their local Head Start. I think Dr. Norma Desjardins is quite adept at that. She's been doing that for a number of years, and it was basically the premise of how St. Apollonia Dental Clinic was formed and gotten it in its infancy to get off the ground. So where are you at in the process of your work with the virtual dental home, Norma, and introducing that concept or going beyond that here in Aroostook County?
So we're ready, but we're exactly where Dr. Glassman was saying as far as the implementation challenges. One of the things that I didn't really anticipate when in the earlier months of leading up to getting this going, which has been months and months and months, but is how is the software going to talk to each other? So, depending on who's using what software, it's true in the US, we all have choices. There are so many choices out there, and there are choices of software, a lot of choices, and there's no mandate that says that, this company has to use this software and it's going to be able to communicate with this company. So we all have choices of our own software. So just even something like that, is some of the challenges, and then the training of, getting together. But I just feel, very lucky that St. Apollonia can work with ACAP on this, because Lucy is a very experienced hygienist who has worked with our patient population for years and years. I know Lucy, I trust Lucy. When Lucy is looking in the child's mouth, I'm going to know that we have calibrated. We have talked about what the expectations are. We have talked about, what should be considered something that needs further attention. And at the same time, she is going to be offering all the prevention for that child that I can't offer if they don't come see me at my office. And so this is all about helping more and more people have better oral health. helping children have preventive services from the beginning, from the very early stages. And we know that dental disease is preventable. And this is all about helping to prevent further disease. So yes, there are challenges, but we are all keeping in mind the big picture and the big goals. And together we're working hard to overcome those challenges and making it happen.
Now, Lucy Morin, I know that Dr. Desjardins spoke about the technology and the integrated records. I know for a fact, because I signed off on the paperwork not that long ago, that you're getting a new dental record, and that's going to allow for a little bit more interoperability between your work and Dr. Desjardins' work, isn't it?
Absolutely. Dr. Desjardins will be able to see my charts in real time. I can just contact her and say, listen, I saw this child, they have an abscess. Will you take a look at it? So it's really, it's kind of neat. I will be starting off in 4 Head Starts to begin with. I will be going to Limestone, Van Buren, Birch Street in Presque Isle, and to Caribou as well. And then hopefully next year we can, implement the other Head Starts as well. So yeah, it's pretty cool.
And I think as Dr. Desjardins pointed out, you're able to be where her patients are at, or where she, I think, hopefully some future patients will be at. And I know that Dr. Desjardins, I've heard her speak about this before, that oftentimes the greatest challenge for patients who end up being no-shows at her practice is a matter of fact a transportation issue. And you are able to get to children where they're at in public schools largely. So are there any conversations that are happening in terms of how you help connect those students to Lucy, including from you, Lucy, to Dr. Desjardins, even when transportation is a factor, or is the presentation of the virtual dental home in some cases closing the loop on that transportation challenge?
I think it's definitely closing the loop on some of those transportation challenges for sure, because at least they can get the prevention aspect. I think there will be a challenge, however, if they need restorative done. And that's something that we will have to discuss and work on.
Dr. Glassman, from your perspective and from what you've seen in implementation in California, California is a big state, Maine's a big state. We cover a county the size of Rhode Island, larger geographically than the state of Rhode Island and Connecticut combined. Dr. Desjardins smack dab in the middle of that area, and there's more than an hour and a half drive from one furthest end to the other to get to her practice. Have you seen any unique solutions that have evolved in California as a result of the virtual dental home to help those who need to go one step beyond that and get to a practicing dentist like Dr. Desjardins?
Yeah, no, thanks for raising that issue, because I think it's a really important one. So for 2 things. One, something you said just a minute ago, we were talking about the fact that many dentists are concerned about seeing people who may be underserved or on a Medicaid program because of what they often refer to as a no-show, or people don't show up for appointments. And as you alluded to, sometimes it's just social issues, transportation issues, et cetera. But when you're working in the school, you don't have that problem, right? Because if in the Head Start Center, their children are going to be there every day. And if you can't get something done today, you come back next week, the same child is still there. So you really don't have that kind of problem anymore. And that solves a number of other things. The question you specifically asked, though, about, so now someone needs to be able to have some work that has to be done in the dental office and beyond what Lucy can do in the Head Start Center. I think the way to think about that is that these are difficult issues. It may take a lot of creativity to figure out how do you arrange or help transportation, help this particular parent get to that dental office. But here's the thing. It's really a different situation than somebody does a screening, for example, which is really widespread in dental care. You do a screening and you say to the parent, you really need to go see a dentist. Here's a list of dentists. Now that's a totally different situation than this, because in this situation, you're going to have the kids are going to be already reviewed. Dr. Desjardins is going to already make a decision about which kids need to see her and which don't. And if it works out like we've seen in many other states, the majority of kids, sometimes even a high majority of kids, don't need to come see her, which means that the number of children that need to see her is much smaller. It's not the whole population. You're not trying to get everyone to go to her office. It's a smaller population. So number one, it's a smaller population. Whatever sort of case management or transportation resources you have, you're not focusing on as many. That's a smaller number. Number two, Dr. Desjardins has already reviewed the person's records. They've seen they've done a treatment plan. She knows exactly what the problem is. She knows what needs to be done. And so the likelihood that they could come to her office just once and get what they need to have done is much better than someone who picks up a phone and makes a cold trip to a dental office. The dentist is going to start with an examination. They're going to start with taking x-rays. That may take up the whole appointment. Now they got to come back again for another appointment. So the fact that you've got a smaller number of people you're working with, you've got more of a system where they come in, they're actually going to get done what they need to get done. All those things really make a huge difference in terms of the likelihood of actually having a successful dental appointment. None of that minimizes the difficulties of someone driving 100 miles, but it allows you to focus your resources on making that 100-mile trip on a much smaller number of people, and you're much more prepared for that visit when they show up. So it's much easier to just get it done. And you can say to the parents, we're not talking about you making 20 trips to the office or going there every 3 months. We're talking about you going there right now because you got these fillings to be done. And then future checkups and things can now be done back at the Head Start Center. So it's a whole very different than the typical, here's a list of dentists, go try to find one, good luck.
And Dr. Desjardins, that would sound to me like it would help both ameliorate some of the transportation challenges, obviously not fully resolve them, but take care of some of the back and forth and multiple visits. It also sounds like from a potential workforce development, because I know all employers are dealing with workforce development shortages, and you haven't been immune from that as well in terms of, qualified personnel. I know you're working with the local adult education to get more dental assistants trained and things of that nature. So do you see some promise in this practice in terms of helping with those very real challenges?
Yes, I do see some promise. And I'm also hoping that it might be that that if the patient truly can't make it to St. Apollonia for their operative work, there may be a dentist that I can communicate with that will accept a referral from us, knowing that we've done the triage work, we've done the comprehensive exam and even radiographs and that sort of thing. So it's possible that we may have other offices that would be able to help out. But you're absolutely right, Jason. These days, it is really tough times as far as staff shortages and having trained staff. And so that's another one of those implementation challenges that Dr. Glassman was referring to.
Yeah, Dr. Glassman, one of the other things I wanted to go back to that you had indicated in one of your earlier questions is it sounds like even though we're getting this off the ground here in the state of Maine, that there is, from your experience in California, ongoing advocacy work and building of the system, if you will, that continues beyond the initial introduction.
Yeah, I think all three of the things I mentioned are not sort of one and done. Things you got to keep on paying attention to. So awareness, I think raising awareness, there's sometimes even some pushback from people who don't fully understand. They hear something about it and they have a negative reaction to it, like it's a bad thing for some reason. So increasing awareness about the fact that it's possible and all the benefits to it is going to be an ongoing, really probably for years, endeavor. The policy work of making sure that you get closer and closer to what I would call an ideal policy environment where it's really clear all the things that can be done. And then all the ways that make sure there's no payment barriers. So because if something can be done, but it's not paid for, people are just not likely to do it. So make sure there's no, and sometimes, it's just the thing, someone does something with well-meaning intention and writes it into some kind of payment guideline and you read it and say, well, now what does that say? Can I really do this or can I not do it? So sometimes there's ongoing work to just clarify all the rules so people are really clear about them. And then as Dr. Desjardins just said, the implementation challenges, I've seen this happen over years that people get better and better at it as they figure out stuff, but there's a lot of bumps in the road that some of them you realize from the beginning and takes quite a while to figure them out, and some of them are new bumps that you didn't anticipate. So what I've seen in people who've been able to work on this for numbers of years is they get better and better at it, work out those things sort of in parallel with the policy environment getting better. And so I don't think that this is the kind of thing where it's all going to get figured out and become kind of mainstream and we can stop thinking about it and pay attention to something else. I think it's going to require ongoing attention and support for a number of years into the future. But I'm already seeing in Maine from the start of the initial announcement about this project, starting to coalesce and people starting to get their heads and hands around what needs to be done and starting to develop ways to do it. So again, the trajectory is good and the promise is good of getting there.
And Lucy, Morin, for you, definitely a value add and something that you're looking forward to getting more into as time moves forward.
Oh, yes. And especially with the software, Jason, like if I am seeing a child in a Head Start and then I see them in kindergarten for, say, fluoride varnish, so they will already be in the system and they will already have a record. And hopefully, continuing through like with the sealant program in 2nd and 3rd grade. And so it's going to be a nice, I don't know, consecutive, movement for me. So very exciting.
That is exciting. And Dr. Desjardins, consistent with that, if Lucy were to work with that child in a Head Start program, they get a referral to you, and then she'd return back in their kindergarten or 1st grade year to work with that child again. And you had worked with that child in between. Will Lucy likewise be able to see what your practice entered in as well, so she can keep tracks on not only her work, but your work as well?
Yeah. And that happens on a regular basis between offices. When we send someone, for example, to the oral surgeon to have their wisdom teeth out, there's communication back and forth. We find out what, we get communication that says, yep, we got the job done. Those teeth are out of there. So yes, there is definitely communication.
Right.
And, I kind of want to mention just real quick, like when you think about it, 10 or 15 years ago, I don't know how many of us would have been that comfortable going to a surgeon who was using a robot, to work on our bodies, thinking about how the surgeon's hands weren't even really going to touch our body, but the robot was. And so some people are having a hard time understanding a virtual dental home because they just can't imagine that a dentist could have a patient and never touch their tooth until they have to, maybe treat it for. So this is a concept that is definitely requires a paradigm shift. It requires, it's an unusual, different kind of concept. Dentistry is so hands-on. I wasn't exactly very appreciative of the concept at the very beginning because I was trained, to be a very tactile provider, of course. But just think about it now. If I needed a procedure, I would definitely go to a surgeon who was using a robot. And it's just been more and more people have gone. There are always concepts where you have, early adopters, mid adopters, and late adopters. So, we're working on a concept that requires a little bit of, trying to get that wrapped around in your head a little bit. So that's kind of, another way of looking at it.
From experience, Dr. Glassman, can you speak about that paradigm shift and any tips of that trade that you might have for Norma and Lucy?
Yeah, no, I think it's absolutely right what Dr. Desjardins just said, that we're seeing this is becoming easier to do because of that phenomenon, which is people are just kind of getting used to it. That I just will reflect back on this is 20 years ago. I had a meeting with a group, doesn't matter which group it was a group of dentists, and was explaining this idea. At this point, it was an idea more than anything we'd actually done. And at the end of the conversation, the response was, they didn't say it exactly like I'm going to say it because I'm making a little bit of fun of them, but the response was, we don't have a clue what you're talking about, but we don't like it. So sometimes that's kind of a sort of knee-jerk reaction. People initially hearing something that seems so different and so foreign, and they get worried about all the things that it could mean. But now we're seeing that this idea is just generally getting accepted, certainly among the dental profession. The American Dental Association just updated a policy statement about teledentistry last year, which is really quite good and recognizes the value of teledentistry and reaching people and doing examinations. And so I think it's becoming more and more generally accepted. And as Dr. Desjardins said, as people see this kind of technology working in other aspects of their lives, it becomes more normal. It becomes part of this is the way the world works now. And so there is, as I said, all these things tend to build on each other. Someone does something, someone else feels a little more comfortable. They do something, that person feels more comfortable. So the trajectory again is really pretty clear. There's more and more acceptance of this style of care, and people seeing the advantage of it.
Well, this has been a fascinating conversation, and I hope that we've helped begin that paradigm shift as Dr. Desjardins spoke of. I got three very busy people here with me, and I know Dr. Glassman has half a workday ahead of him on the West Coast. But before I let you all go, sort of wanted to get some last thoughts or anything that you didn't share in the context of this interview about the virtual dental home or any related component to it that you wanted to make sure folks watching this edition of ACAP today walk away with? So let me begin with you on that, Dr. Glassman.
Well, I guess I would just summarize, slightly repetitive for what I said earlier, but I just summarized the fact that I think where we are going and where we need to go is this thing I've been calling community engaged oral health systems, where we stop thinking about the dental office as the center of the dental universe. The dental office has a very important place, as the dentist does, but it doesn't have to be the center of the system. That if we can begin to engage with community structures like Head Start and other community structures and begin to think about all the ways that we can reach people and reach people better, frankly, in the community than we can sometimes in an office, and how to connect those all into one interconnected system. I think we really have the ability to create what I call full service systems of care that really make a lot more people healthy, reach a lot more people, make a lot more people healthy than we can before. And as we begin to do that and learn better about how to do it, we're going to see the benefits for everyone. These are clearly benefits as we move in this direction for people who have trouble getting dental care in the traditional system or having good oral health, clearly benefits for the providers who can reach a lot more people, and then benefits for people who are paying for dental care, because we have the ability for the people paying the bills to be able to, I call it, buy a lot more health per dollar. So I see benefits for everyone. And really, as Dr. Desjardins just said, it is a fundamental paradigm and mental shift to think about a community engaged system as the way we need to start thinking about oral health as we move forward.
Dr. Desjardins, your any other parting thoughts that you would like to share with us, or things that we've left sort of on the cutting room floor that you want to make sure get out there to folks?
Well, I just want to, share that, like Dr. Glassman just mentioned, the dental office being, the center of the dental universe was always my way of practicing. And, I loved being in that practice and having patients come to me. And, I did that for many, many years. Families came to me and at our dental office. And what I didn't realize were the numbers and numbers of little ones who were not getting to any dentist. And those were invisible to me when I was in that center of the dental universe. And so now what my practice has become, and my philosophy is, how can we reach those who cannot come to the dental office, and how can we give them good care, and how can we give them good prevention and take care of their oral health needs so that they can keep their teeth for their whole lifetime, like I teach kids every single day. So that's where we're at. That's just one provider's point of view right here in a small little part of the universe, but just hoping to try to fill the needs for every person in our communities.
Thank you, Dr. Desjardins. Lucy Morin, I've worked with you for 7 years, and it's taken me that long to realize that my life is better if I let you get the last word. So you got the last word on this one.
Oh my gosh. So for me, I just want to tell parents that if you have any questions at all about the virtual dental home, reach out to us at ACAP or reach out to St. Apollonia and we can explain it to you. It is an amazing way. If your child doesn't already have a dental home, it is an amazing way for your child to have a dental home. And in this day and age, it's so important. Everybody needs a dental home. So please reach out to us if you have any questions.
Great, Lucy. Thank you so much. And I mentioned my 7 years, but I would be remiss if we'd let this episode go without congratulating you on your milestone anniversary with ACAP. You've been here how many years? 20 years this year. we're welcoming her into our veteran program. She gets to go to the veteran luncheon this year for the first time, and so pleased that you've been providing services through ACAP for 2 decades, Lucy.
It's gone by fast.
Thank
you, Jason.
Dr. Glassman, thank you so much for joining us from the West Coast. Dr. Desjardins, thank you for joining us from across town, and for all that you do to support the work that we do and to partner with us to serve the underserved population of Aroostook County. It's always a pleasure to connect with you in various and many ways through this venue and in the community. So thank you all for all that you do. Before we leave all of you out there, we do as we do at each point in the program, share with you our photo of the week. And all this year, celebrating our 50th anniversary, we've been throwing it back to photos from our our time vault, if you will. And so this week we're going to do that as well. And we're going to throw you back to the early 1990s with this picture right here. This is Louetta Clark Goodall, a former ACAP employee working with an employment and training client in the 90s using some piece of technology that looks antiquated today, but I'm sure was cutting edge in the 1990s. And just like Dr. Norma Desjardins said, hey, we wouldn't have imagined having a robot with a surgeon not in the room operating on us. I don't think we'd imagine using that piece of technology today. But anyway, thank you all for joining us on this edition of ACAP Today. We'll be back next week with a brand new edition, and we'll see you then.
Thank
Thank you,
you.
Jason.
Thank you.